My name is Andy Grinnell, and I'm a clinical exercise physiologist with MedFit. MedFit is Ireland's only medical exercise facility, and we specialise in helping people improve their quality of life, no matter their health background, through our multidisciplinary team and high-spec facility. This presentation is titled The Biological Processes of Aging: What Happens to Our Body When We Get Older. This talk is part of a series of presentations related to the Active Aging Communities Project. The aim of this project is to improve how exercise is delivered to older adults in the community across Europe. MedFit is one of 18 sites across 6 EU countries delivering this project. All participants will receive standard care at MedFit, where our services are at the cutting edge of healthcare when it comes to management of aging and chronic disease through lifestyle changes. This talk is not limited to just participants from the Active Aging Communities Project. Indeed, we encourage all clients to watch this video and to share with anyone they think may benefit, as our services are open to a variety of individuals. So with that being said, let's talk about the biology of aging and what it means for our physical function. So, life expectancy. What is life expectancy or lifespan? Well, it's defined as the number of years a newborn is expected to live. As you probably know, life expectancy has not been the same or constant in the past couple of hundred centuries, but has dramatically increased. Looking back to 1800, there was little medical knowledge worldwide. Demographic research indicates that no countries in the world at this time had a life expectancy above 40 years, and the global life expectancy was just 29 years of age. Over the following 150 years, some areas of the world achieved substantial health improvements. Looking at 1950, life expectancy increased to over 60 years of age in several regions, including Europe, whilst the global life expectancy was much lower at 46 years of age. This is because in other areas, such as African countries, the life expectancy was still extraordinarily low, and it was estimated to be just 30 years of age. But in recent decades, substantial health progresses have occurred due to scientific developments and health policies both within the most developed as well as the least developed countries. As a result, in 2015, global life expectancy was 71 years of age. Today, life expectancies in some of the most developed countries has reached the average age of over 80 years of age. Indeed, in 2019, the life expectancy in Spain, Switzerland, Italy, and Australia was over 83 years of age, with Japan currently the country with the highest life expectancy of about 85 years of age. So now that we are thinking about lifespan and humans living longer, we also need to think about health span. So we just looked at lifespan, which is how long we live, and around the globe, on average, this has been positively impacted by both health policy and scientific progress. We now have to think about how we live during these extra years, and this is where health span becomes important. Whether these extra years of life gained through increased life expectancy are spent in good or bad health is a crucial question, because living longer does not necessarily mean living better. A good way to start thinking about health span is through the concept of healthy life years, which are defined as the number of years that a person is expected to live in healthy conditions. Healthy condition here means one without limitation in functioning and without disability. This focuses on the quality of life spent in good health and with good function. For example, being able to perform the daily activities we normally would perform at a younger age, such as cleaning the house, golfing, hiking with friends, or playing with grandchildren. So the focus here is on the quality of life rather than the quantity of life. Overall, healthy life years is an important indicator of the relative health of the population, and in Europe we expect both men and women after the age of 65 to have 10 years in a healthy condition. But what about specific countries? How many years do we expect to live in a healthy condition if we live in Finland, Ireland, Portugal, the Czech Republic, Italy, or Greece, for example? These are the 6 different countries taking part in the Active Aging Communities project. Ireland certainly stands out as having a good outcome for people over the age of 65 when it comes to living in a healthy condition, with around 14 years for women and 13 years for men. Now, getting back to the aim of the Active Aging Communities project, it is to understand how we can use education, diet, and exercise to favourably improve outcomes for everyone in the EU and beyond, and give more people the chance to gain years in a healthy condition. It is important to say that there is no typical older person. Some 80-year-olds have levels of physical and mental capacity that compares favorably with someone a lot younger. Others of the same age may require extensive care and support for basic activities like dressing and eating. This is because we all have very different genetics, life circumstances, and lifestyles. But this connects to how we think about what affects how we age. Although some of the variation in older people's health and ability to age well are genetic, much of it is due to the individual's physical and social environments. For example, the structures and opportunity in the neighbourhood from a young age and in the community, along with additional characteristics such as gender, ethnicity, and socioeconomic status. These factors begin altering aging trajectories at an early age. The environments where people live from childhood, combined with their additional characteristics, have long term effects on the aging process. The environment may also influence the development and maintenance of healthy behaviours. Maintaining healthy behaviours throughout life, particularly eating a balanced diet with few calories coming from processed foods, engaging in regular physical activity, and refraining from smoking and excessive use of alcohol all contribute to reducing the risk of non communicable diseases and improve physical and mental capacity. The behaviours that increase the probability of aging well also remain important in older age. For example, strength training to maintain muscle mass and good nutrition can both help to preserve cognitive function, delay care dependency, and reverse frailty. Supportive environments are also important as they enable people to do what is important to them despite losses in capacity. The availability of safe and accessible public buildings and transports and environments that are easy to walk around are example of supportive environments according to the World Health Organization. So, some things we cannot modify, such as our genes, although this may change in the future. However, the factors I'm going to discuss with you are considered some of the most important modifiable factors when it comes to healthy aging. A factor is defined as modifiable if certain things can be altered by the person to change it. For example, we can modify our physical activity, nutrition, sleep, and stress. So, what is physical activity? Physical activity refers to all movement we do during the day, whether it is incidental as a result of housework, or playing golf, or walking the dog. Exercise is when the physical activity is planned and prescribed. Both physical activity and exercise are two of the most potent modifiable factors influencing our trajectories of aging. The evidence is truly overwhelming. The question which is often asked is, what is the best form of physical activity when I am older? The best form of physical activity is indeed the one you enjoy and that you can fit in throughout the day. Nevertheless, some types are more effective than others. For example, as people age, there is a loss of muscle mass. This is a natural phenomenon, and that will be touched upon in this talk. If such losses of muscle reaches a critical level, it will affect the ability to do activities of day-to-day living, like washing, shopping, visiting friends. It can also contribute to other important aspects of our life, such as poor balance and the consequent greater risk of falling. Physical activity should ideally target these aspects. Using structured exercise such as strength training in conjunction with increased physical activity and dietary changes is the most effective means of reducing muscle mass loss. Looking at nutrition, as we get older, our nutritional needs change. Whilst weight loss generally gives us health gain, as an older adult we have to take a careful approach. Losing weight is often associated with losing precious muscle mass, which we need to function optimally. Unless dietary changes are accompanied by an appropriate exercise program and adequate protein intake, there is a risk of muscle loss, leading to a decrease in strength, which can accelerate even faster the aging process. With regards to social engagement, people with higher levels of social engagement have decreased mortality and a higher health status for longer. It is not just about the number of friends someone has, it is about the quality of these relationships. Supportive and rewarding relationships should be cultivated. A higher level of social engagement can even help recovery from illness and even decrease the chance of leaving hospital with a new disability. With regards to physical function, it is usually described as the ability to perform tasks such as walking, getting out of a chair, or going up the stairs. Maintaining our physical function is important for everyday life. Functional limitations, which can be determined by functional tests we do at MedFit, for example, gait speed, balance test, or chair rises, these have been shown to predict future disability, risk of falls, cognitive decline, hospitalization, and mortality. Experiencing difficulties in rising from the chair or getting in and out of bed and getting dressed are signs of a decline in physical function. With regards to cognitive stimulation, the old saying, use it or lose it, is very true for our brains. Our brains retain the ability to learn and change well into older age. It is not enough to keep doing the same routine. To protect our brain against decline, we need to keep challenging ourselves. A study on older adults who were provided with brain training in memory, reasoning, and speed of processing showed that the intervention improved their level of functioning in daily activities. Like physical activity, the right cognitive activity is the one you are interested in. It is also important to consider the effect of exercise on our brains. When we exercise, our muscles produce hormones called myokines, and these can travel through the bloodstream and interact with our brain in a positive manner, and here they can improve cognitive function. In addition, it is well established that exercise positively impacts on stress, anxiety, and depression. So it is unsurprising that a good level of physical function is important for living independently with a high quality of life. As just described, functional limitations have been shown to predict future disability, admission to a nursing home, risk of falls, cognitive function decline, hospitalization, and mortality. It is therefore unsurprising that physical function is associated with everyday activities such as cleaning, shopping, showering, and even changing our clothes. Our physical function is strongly affected by our muscle mass and muscle quality, our neuromuscular function and control, and our cardiovascular function. These are aspects we aim to improve at MedFit through a targeted exercise program. So let's talk a little bit about the biological determinants of physical function. Firstly, we have our muscle. Muscle mass is a very important factor to maintain good physical function. Low muscle mass leads to reduced strength and thus reduced physical function. When we age, muscle mass and muscle quality diminish and fat starts to infiltrate the muscle. At MedFit, we were able to examine muscle mass through a body composition assessment. Our neuromuscular function is often measured as the ability to produce force or power through our muscles. Muscle strength is defined as the maximum load or weight one can lift only one time. Muscle power, on the other hand, is the product of both muscle strength and speed. This means that muscle power depends on how fast one can move an object or a weight. Muscle power plays a key role for tasks where speed is important, for example, when attempting to reverse a potential fall after stumbling. How strong and powerful you are depends on the muscle mass and quality of those muscles. In other words, it depends on how strong your muscles are. It is also important to consider that in order to maintain a high level of physical function, such as walking, good postural control is essential. Postural control can be defined as the way our central nervous system, that is our brain, integrates the information from our sensory system, such as pressure receptors in our toes, and provides a coordinated motor response which allows us to maintain a controlled upright posture and therefore good balance. This is extraordinarily important, for example, when we have to rapidly react to unexpected perturbations, such as tripping over an object. At MedFit, we examine these qualities by measuring grip strength, sit-to-stand ability, stair climb ability, and balance ability. Our cardiovascular function is also important for maintaining physical function and everyday activities such as shopping, cleaning the house, walking the dog, or playing with grandchildren. One way to measure cardiovascular function is to assess maximum aerobic capacity, or what we call VO2 max, and this can be done on a treadmill or a bicycle. Maximum aerobic capacity can be defined as the maximum work that an individual can do, which is assessed by the oxygen uptake during such work. There are different key physiological components important for the VO2 max, including the maximum amount of blood that the heart can pump throughout the circulatory system in a single minute, which is also defined as our cardiac output, or how much oxygen can be extracted by the working muscles. At MedFit, we are able to examine your aerobic capacity through a submaximal and safe cycling test. So we have been starting to think about offsetting functional decline, but what exactly happens when we look under the hood of the car? In the next few slides, I will present what happens as we age. We will focus only on a few key aspects, which are muscle mass, muscle strength, and cardiovascular function. This picture shows an MRI scan of the thigh of a young 24-year-old on the left, a sedentary 66-year-old in the middle, and an active 66-year-old on the right-hand side. Take a moment to look at the differences. The dark grey colour indicates muscle mass. Muscle is clearly larger for the younger and the active older adult compared to the sedentary older adult. If we look inside the muscle and under the skin, there is an increase in fat as indicated by the white colour in the sedentary older adult compared with the active older adult. The decrease in muscle mass and increase in fat both play a significant role in determining the quality of muscle function. Importantly, as the image on the right shows, we can modify our body. The loss of muscle mass occurs early on in life at around 1% per year. In severe cases, due to a multitude of factors, there can be a loss of 50% of muscle relative to peak values by the time someone is in their 80s. Importantly, muscles display plasticity, which means that they can increase in size even in previously sedentary older individuals if a specific type of exercise is combined with nutritional therapy is initiated. Strength training is very effective to increase or even just maintain muscle mass. Here, adequate protein intake is very important. In another video, we will be discussing nutrition in depth. Maximum muscle strength tends to peak in our 20s and 30s and then plateaus until around the 50s, and then afterwards it decreases with a rate of 12 to 15% per decade, with more rapid losses occurring in people over the age of 65. Muscle power seems to decline earlier and more rapidly than muscle strength, by about 3.5% per year after the age of 65. How strong and powerful we are depends on our muscle mass and muscle quality and the ability to stimulate the muscle by the nervous system. Something for you to think about is, have you been experiencing a change in how strong you are or how rapid and powerful your movements are compared to when you were younger? This could be when you're playing golf or playing tennis or just doing household activities. Muscle strength is very important for maintaining physical function, to perform daily activities such as shopping, cleaning, or walking with friends, and to live an independent life. A person needs a certain amount of muscle function to perform these daily activities. Even simple tasks such as crossing a road with a green light require the ability to generate enough walking speed before the traffic light turns red. Walking speed itself is generated by our neuromuscular system, which translates the muscle contractions in our legs into rapid movements that allow us to cross the road. When our muscle strength and power is markedly reduced, we are unable to generate strength and power, and this can impact our ability to cross the road before the light turns red again, for example. When we get older, we need to also think about factors that can significantly impact on muscle mass over a short period of time. Whilst the COVID pandemic has changed our behaviours and reduced our risk of getting a cold or flu, as we move forward with society reopening, the risk of infection increases. When we get a virus such as the flu, this can leave us bedbound for a few days, and this impacts on our muscle. This graph shows what happens to muscle strength after a short-term disuse. Most of us have experienced short-term immobilization, for example being bedbound with illness such as pneumonia, having an ankle injury, or a fracture or even a joint replacement. Depending on the issue, this can lead you to being out of action for 1, 2, 3, or even more weeks. In this graph, we can see the rapid decline in muscle strength within the first few days of disuse. After only 5 days, you can lose up to 10% of your muscle strength. Now, this may not seem like a lot, but please consider that this corresponds to 3 to 6 years of normal biological decline occurring in just 5 days. So in other words, if you stay in bed and are more or less immobilized, your body will deteriorate extraordinarily fast. This can have important functional consequences for older adults, especially those who are already frail. The most important consequence is that this individual may be unable to stand on their own feet or rise from a chair or climb the stairs after this period of bed rest. Therefore, it's important to start exercising shortly after the disuse period and regain this muscle strength and minimize as much as possible bed resting. It's also important to be fit and strong to ensure a quick and fast recovery from an illness or a surgery, which will limit the risk of experiencing decreases in muscle size and strength. So we are now going to shift our focus from the skeletal muscle to our heart muscle. Something for you to think about. Did you know that your heart will beat around 100,000 times a day? So for someone who's 70 years of age, their heart will have beaten close to 2.5 billion times. And do you know how long your blood vessels are if we were to take them out of our body and stretch them out? Well, if we were to do that and align our blood vessels, they would extend to 100,000 kilometers. So we have a huge system in our body that's constantly at work, which means we have to really look after it. Our heart is one of the key players in determining our aerobic capacity. Aerobic capacity, to remind you, is our ability to do physical work, and this declines with age by approximately 10% per decade from the age of 25. The rate of decline seems to be similar between groups with different fitness levels, so we cannot maintain a peak level of fitness throughout our life. The good news is that a person who has stayed physically active and has a higher level of aerobic capacity will remain fitter than a sedentary person throughout the lifespan, as shown in the image on the right. Importantly, we can improve our fitness throughout the lifespan with the right training approach. For example, a 70-year-old who has never exercised before can experience an improvement with the right training approach. And getting back to function, we need a certain amount of aerobic capacity to perform daily activities such as shopping, cleaning, showering, playing with grandkids, or playing tennis. This means that the person with better aerobic capacity may experience fatigue much later and may be able to perform more everyday activities throughout the day. I know many people watching this video may have been diagnosed with osteoporosis or osteopenia, or maybe a family member has been diagnosed with these conditions, which are reflective of a decrease in bone mineral density. That is because, similar to muscles, bones undergo a remarkable change with increasing age. Bone mass and bone strength are progressively reduced as we get older. This is more pronounced in women after menopause. Key factors related to such changes are the level of physical activity, loss of calcium and other minerals, as well as hormonal changes such as changes in estrogen. Low bone density is an indication of a fragile bone, which means that this bone has a greater risk of fracture if it is subject to excess stress. Overall, osteoporosis is a common problem among older adults, especially postmenopausal women, and is a major cause of hip fractures. Our spine is made up of bones called vertebrae, and a reduction in the density of these vertebrae combined with a loss of fluid in the discs in our back between these vertebrae is one of the reasons why some of us will experience a reduction in our height as we get older. So far, we've established that to carry out daily activities, we need a given level of muscle function and strength and aerobic capacity. When we are young, daily activities are not very demanding. This is because our maximum level of strength and aerobic capacity, along with other factors, are high, and the activities we perform are not overly demanding as a result. In other words, we do not even consider that, for example, getting dressed may feel like it's giving us a lot of exertion. However, when we get older, both our maximum strength and aerobic capacity declines. This decline may make activities that would have been extremely easy, such as getting dressed or getting in and out of the car, progressively more difficult for some older adults. This also means that even light activities such as cleaning and doing the laundry are difficult to carry out, and they can cause profound fatigue. Overall, this decline puts us at risk of developing frailty. This graph illustrates that we want to improve our physiology, that is, our strength, aerobic fitness, balance and mobility across the lifespan to keep functional limitations at bay. To highlight this further, the red line is the functional ability and subsequent decline over time of an individual who is sedentary. The blue line is what can happen if this same individual were to engage in structured, safe, progressive, and most importantly, personal exercise. Where an injury or illness would have had devastating consequences for the sedentary individual, this would be something the active individual could recover well from. Maybe you yourself have had a joint replacement or severe infection. Did you recover quickly? Maybe a friend or family member of yours who is very fit has anecdotally told you that their fitness helped them recover well. This is an important effect of being fit, as it can help us recover. The final aspect of our physiology that we will look at in this presentation is the sensory system. The sensory system provides our brain with the relevant information which allows us to navigate throughout the environment and carry out any activity we wish. Just as an example, maintaining our posture in a static upright position seems quite simple. Nevertheless, despite this being more or less automatic, It is physiologically a very complex task which requires the integration of sensory information fed back from different areas of our body, including mechanoreceptors, which are the receptors that measure pressure, for example, in our feet and toes, or our eyesight, which plays a fundamental role. Just to give you an idea of how important the information we get from our eyes to the brain is, try to balance on a single leg. Please only do this with someone close by, just in case you lose your balance. This alone is not very difficult for some people. Now, if we try to do it with our eyes closed, it's a completely different task. So we need to think about how to preserve the function of all of the information sources that help us maintain good balance. So what are they? So, as I just described, it's our eyesight, our vision, and our eyes undergo several age-related changes as we age. For example, it takes longer for our eyes to focus on close objects and visual scanning becomes difficult. These simple changes may lead to an increased risk of falling. A decrease in eyesight can reduce quality of life and threaten our ability to live independently at home and in the community. It is always a good idea to talk to your doctor or optician about the health of your eyes. Our vestibular system is also important. This system is within our inner ear and monitors motion and provides orientation, such as what is up and what is down. Studies have shown that the number of nerve cells in the vestibular system decreases with age, and this may result for some people in balance or dizziness problems. The somatosensory system is the normal feedback our joints and muscle provide to the brain. With age, such feedback declines because, for example, the number of pressure receptors in our toes decreases or our muscle size and quality decreases. Collectively, this can contribute to postural instability and poor balance in older adults. So you may be thinking to yourself that perhaps you, a friend or a family member, that the ability to balance has changed over time, and this is now having an impact on your quality of life or someone you love. You might be thinking, should I be worried? Well, the reality is that balance is a crucial component of everyday life, from getting out of bed in the morning to sitting, standing, and walking throughout the day, playing with grandchildren and playing golf. When balance is poor, it's linked with several adverse health outcomes. Perhaps most notably and most obviously is increased risk of falling, but also with increased risk of disability, fractures, and hospitalization. So have you or someone you know experienced a fall? This is something we talk about in depth in clinic at MedFit to examine the cause and thus find ways to make appropriate changes. It's important to remember tripping is something that happens to us across the lifespan. But when we are strong, powerful, have good reaction time and balanced ability, we can rapidly recover by adjusting with our legs or saving ourselves by using our hands. And being able to do this matters because falls can cause fractures, as we've discussed, for example, to the wrist, arm, ankle, and hip, especially in those with weak bones. And it can also cause head injuries if we're not able to protect our head during the fall, for example, by reducing the impact with our arms. So let's take a bird's eye view now of how we can take care of our balanced ability and decrease the risk of falling. The first thing to do is stay active. As you've heard, when we get older, muscle function and balance decline, and this can lead to an unexpected fall. Exercises designed to improve muscle function and reaction time can reduce your risk of falling by improving your posture, coordination, muscle strength, power, and balance. There is an abundance of evidence to support this. Next is taking care of your eyes. Poor vision can be a critical component for loss of balance in a fall. So get your eyes checked and glasses regularly, at least every 2 years. This will show potential issues which may simply be reversible. It's important to also check your hearing. As you get older, you might find your hearing has changed and it's more difficult to hear conversation and some tones. Talk to your doctor as soon as you think your hearing has declined, as a problem with your ears can severely affect your balance. The problem may be something easily treated, such as a buildup of earwax or an ear infection, or it may be that you need a hearing aid. It's important as well to manage your medications. Certain medications can make you dizzy and affect your balance, especially those that manage blood pressure. Always let your doctor know immediately if you experience side effects of new medications. They may need to check the dose or provide alternatives. It's important to eat well and support your bone health. Getting enough energy and protein is important in keeping muscle mass in function and preventing falls. Keeping your bones healthy and strong by eating calcium rich foods and trying to expose ourselves to sunlight with care will ensure that we get enough vitamin D. It's also important to remember to do weight bearing exercises, and this is something we're going to discuss in a future presentation. And lastly, something that sometimes is not considered is choosing the right shoes. Problems with your feet or shoes can affect your balance and increase your risk of tripping or falling. Always make sure that your shoes fit well and do not tend to slip off. Also, avoid wearing sandals with very little support and shoes with high heels. Finally, it's important to think about fall proofing the house. For many of you, this is not an issue, but maybe it is for your parents, your aunts, or uncles. It's a good idea to always think about removing things you can trip over, such as raised doorway threshold, area rugs, or clutter. Rugs and mats at the top or bottom of the stairs are a trip hazard and can easily lead to a fall, so it's a good idea to move them out of the way. Also, using non-slip protection under the carpets, such as tile and wooden floors. Welcome mats and small rugs inside your entry may seem like an inviting touch, but they can also be a trip hazard for some people. It's also important to remove some furniture and electric wires from walking areas that might increase the risk of falling and tripping. It's also important to secure sufficient indoor and outdoor lighting. Installing a night light near the bed to make sure that you wake up in the night and can see where you're going is really important. You can install motion activated light that comes on as needed, and that's something that you can talk to with your local supplier. You can also make sure to check that your outdoor areas have good lighting, which is really important when coming home at night. Lastly, mount grab bars near the toilet and on both the inside and outside of your tub and shower can be important, or may be important for someone you know and love. The floor is a really slippy place in the bathroom after a bath, and having the correct devices nearby to decrease risk of falling is extremely important. So for you listening to this presentation, have you a chronic condition and how has it affected your life? The theme of this presentation has been the biology of aging, but for most people over the age of 65, they are living with a chronic disease. These chronic diseases include, but are not limited to the following: arthritis, which is one of the most common medical conditions among older people and causes pain, stiffness, and restricted movement. Physical activity and exercise can help prevent and often be an effective treatment of arthritis. High blood pressure is very common among older adults. Many people live with hypertension without noticing, so it's important to have regular checks with your GP. Risk factors for hypertension include smoking, poor diet, and physical inactivity. Diabetes is where your blood sugar levels become too high. In type 2 diabetes, it is the most common form, and it's more pronounced in older people. Prevention and treatment of type 2 diabetes is healthy eating, weight management, and regular physical activity. COPD is a lung and airway disease that are common around older adults, which can cause breathing difficulties. There is no cure for COPD, but with the right treatment, such as medication and inhalers, most people can manage this condition very well. Physical activity and exercise are important to prevent COPD as well as maintain functional capacity while living with COPD. One of the biggest risk factors for COPD is to have previously smoked. As we discussed, osteoporosis is a condition that's characterized by weakening of the bones and is a common problem among older adults, especially postmenopausal women. Weight-bearing exercises, strength training, and appropriate diet, along with medications, can help prevent and combat the condition. Calcium and vitamin D are particularly important here as well. Importantly, and this is something we specialize in at MedFit, we work with people who suffer with 1, 2, 3, or even more chronic conditions occurring at the same time. The science shows us that when exercise is personalized and safe, we can improve function and thus quality of life in people suffering with a multitude of different chronic conditions. So, to conclude this presentation, there is no typical older person. It is dependent on a multitude of factors such as our genetics and what has happened to us throughout the lifespan. But there are important pillars for healthy aging and things that we can modify to age well. These include nutrition, physical activity and exercise, social engagement, physical function, and cognitive stimulation. As we've discussed in depth, muscle mass, muscle function, muscle strength, muscle power, and aerobic capacity decline with age. But the rate of decline depends on multiple factors that we can modify, such as our physical activity level and nutrition. Falls can lead to serious injuries like hip fractures. Balance problems, muscle weakness, diminished eyesight, and slower reaction time can increase our risk of falling. Many falls happen in and around the home, therefore we need to be aware of poor lighting, slippery surfaces, trip hazards, and unsafe footwear. Ultimately, however, exercise and lifestyle changes are essential to both prevent and manage chronic conditions. And at MedFit, we specialize in taking care of patients from a number of difficult backgrounds to help them improve their quality of life and thus wellness. Thank you very much for taking the time to watch this presentation today. Many of you are already active clients at MedFit, but if you're hearing about us for the first time or a friend has sent you this video, you can find out more about us by visiting our website at www.medfit.ie or visiting us in Blackrock or contacting us by phone. This presentation is a series of 3 talks about aging and is part of the Active Aging in the Communities project. This is one of several research projects we are undertaking at MedFit. Again, to find out more, please contact us or visit us to meet us in person. Thank you.